Hi everyone. Today we're diving into a crucial medical topic, the emergency signs of cholecystitis and when you need to seek immediate medical care. This information comes from Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE. We've created this guide to help you recognize serious warning signs that should never be ignored. Let's explore these vital symptoms together. Let me explain cholecystitis. That's the medical term for gallbladder inflammation. Your gallbladder is a small, pear-shaped organ sitting right beneath your liver that stores and concentrates bile for digestion. When bile can't flow properly, it gets trapped inside the gallbladder, causing inflammation. It's similar to a pipe getting clogged and pressure building up inside. Now let's talk about gallstones. They're the usual suspects in these cases. These hard, pebble-like deposits that form inside the gallbladder are responsible for more than 90% of cases. When a gallstone blocks the cystic duct, think of it as the gallbladder's exit door. Bile gets trapped, creating pressure, irritation, and eventually inflammation. While gallstones are the main cause, sometimes tumors or infections can trigger similar problems. Here's why this matters so much. Untreated cholecystitis can quickly escalate from uncomfortable to dangerous. 3 severe complications can develop if warning signs are ignored. Your gallbladder could rupture, releasing infected bile into your abdomen. The infection might spread to your bloodstream, causing sepsis. Or you could develop pancreatitis if gallstones block the bile duct. That's why getting medical help early is absolutely crucial. Let's focus on 5 critical emergency signs that mean you need medical attention right away. If you experience severe abdominal pain, persistent nausea and vomiting, jaundice, abdominal tenderness, or high fever with chills, don't wait to get help. These warning signs are especially concerning when multiple symptoms occur together. The first major red flag is severe and constant abdominal pain. This pain typically shows up in the right upper quadrant of your abdomen, just below your ribs. What makes it particularly worrisome is its character. It's a sharp, persistent discomfort that gets worse over time, not just a dull, occasional ache. Pay special attention if the pain spreads to your right shoulder or back, as this radiation pattern is particularly significant. The second critical warning sign is persistent nausea and vomiting that just won't quit. This isn't your typical upset stomach. It's relentless and doesn't improve with regular over-the-counter medications. When you can't keep down food or liquids, dehydration becomes a real concern. If this occurs alongside severe abdominal pain, you need medical evaluation right away. Don't try to wait it out. Get professional help promptly. Another serious warning sign to watch for is high fever with chills. When your body temperature rises above 38 degrees Celsius or 100.4 degrees Fahrenheit and you're experiencing uncontrollable shaking, it's a strong indication that gallbladder inflammation has developed into an active infection. This combination of symptoms demands immediate medical attention. It's a sign that things are getting serious. Next up is jaundice, a concerning condition where both the whites of your eyes and your skin take on a yellowish tinge. This happens when bile flow becomes severely blocked, causing bilirubin to build up in your bloodstream. You can clearly see how jaundice changes the eye's appearance compared to normal coloring. Given its serious nature, jaundice requires immediate medical evaluation. The 5th key sign is tenderness in the right upper abdomen. When this area is pressed, it causes pain, and there's a distinctive rebound tenderness, meaning the pain actually gets worse after you quickly remove the pressure. You'll notice the abdominal muscles instinctively guard the area, becoming tense to protect the inflamed gallbladder underneath. Let me be crystal clear about when to seek emergency care. If you experience severe abdominal pain along with any of these 4 warning signs, persistent vomiting, fever, jaundice, or tenderness, don't second-guess yourself. Go straight to the emergency room. While it's normal to question whether your symptoms are serious enough, it's always better to be evaluated than to risk complications. When you arrive at the hospital, here's what to expect. The diagnostic process follows 3 key steps that help your medical team work quickly and effectively. They'll start with an evaluation, reviewing your medical history and checking for abdominal tenderness during a physical exam. Next come blood tests to check for infection signs and assess liver function. Finally, imaging, typically an abdominal ultrasound, will give them a clear view of your gallbladder to check for inflammation or gallstones. Sometimes they'll need a CT scan for an even more detailed look. Let's talk about how cholecystitis is typically treated. The first priority is stabilizing your condition using IV fluids, pain medication, and antibiotics to control infection. Once you're stable, you'll need definitive treatment, usually gallbladder removal through cholecystectomy. Doctors prefer using laparoscopic surgery with small keyhole incisions, as it means less pain, shorter hospital stays, and faster recovery compared to traditional open surgery. You can take steps to protect yourself from gallstones and cholecystitis through smart lifestyle choices. Maintain a healthy, steady weight, but avoid rapid weight loss, which can actually trigger gallstone formation. Eat a high-fiber diet rich in fruits, vegetables, and whole grains. Choose healthy fats like olive oil, avocados, and nuts instead of saturated fats. And stay well hydrated by drinking plenty of water throughout each day. These simple habits can make a real difference in protecting your gallbladder health. Here's what I really want you to remember. You have the power to protect your health. While cholecystitis is serious, knowing what to watch for is your best defense. Be alert for those 5 key emergency signs: severe right upper quadrant pain, persistent vomiting, fever, jaundice, and tenderness. When these warning signs appear, don't delay. Get medical help right away. Your quick action could be life-saving. I need to share an important medical disclaimer. While this information is educational, it's not a substitute for professional medical advice. Always consult your physician about health concerns, and don't hesitate to seek emergency services if you're experiencing a medical emergency. Remember, this information doesn't create a doctor-patient relationship. Your healthcare provider remains your best resource.